Hi, I'm Dr. Michael Wilmink. I work for OSNA, and I work at the AOA's division of OSNA. I grew up in Vancouver, came down to UCLA for my regular undergraduate education, then went back to Vancouver for medical school and residency. Finished in 2002, and then subsequently moved directly to Arizona. I've been practicing here in the Valley for about 9 years. I'm a Canadian Royal College certified orthopedic surgeon, and then in 2004 I became an American board certified orthopedic surgeon. Typically, we'll see patients present with three types of hip pain. The first being deep groin pain in the hip. That's typically associated with hip arthritis in an elderly patient, or hip impingement or labral tears in younger patients. The second type of hip pain is pain on the outside, the lateral portion of the hip, and that usually presents as trochanteric bursitis or abductor muscle tears, which we call rotator cuff disease of the hip. And the last one typically is patients will present with buttock pain. This can either be referred pain from the back, or in instances where patients step up a curve or trip or have a fall, they can sometimes tear their hamstring origins off their ischial tuberosity. Over the past 5 years, we've really become more cognizant of what we call the rotator cuff disease of the hip, which is tears of the abductor tendons, the gluteus medius and minimus tendons. Those are the strong abductors for the hip, and patients will present with lateral sided pain that sometimes starts as bursitis but gradually gets worse with no real history of trauma. The other tendons that can tear around the hip are hamstring avulsion tears. This is typically seen in a patient who falls off a curb, steps down, or is water skiing, and they actually tear the origin of their hamstrings right off their ischial tuberosity. It's a very painful episode. I've had many female patients tell me that it's more painful than childbirth. And they usually hear a loud pop, and they present to the office with a lot of swelling in their leg and typically bruising that runs from their buttock all the way down to their knee. Hamstring avulsions actually are something that's quite frequently missed. The really only truly way to diagnose it is with an MRI, and we usually don't like to say that as orthopedic surgeons. We like to see patients, examine them, x-rays, but really the only way to confirm a tear is either a large palpable gap in their posterior buttock or their hamstring area, or to get an MRI to demonstrate how severe the tear is. Other things that they can present with are weakness of hamstrings function, which would be flexion of the knee. And then treatment, generally, as in all tears that we see in tendons, there's, grade 1, 2, and 3. Typically, if they have a tear where there's just pulled a little bit of the tendon off and it's partially detached, those can be treated very effectively with physical therapy and anti-inflammatories and time, and the majority of those heal and go on to do very well, although patients will have symptoms for 6 months up to a year out from the injury. And the severe injuries where they actually tear off the whole origin, the muscle usually will retract down about 4 to 5 centimeters, and it causes a significant amount of pain. And these are the patients who are black and blue, basically down to their knee. The management of that is open repair, which is a pretty significant endeavor, because when we go into the hip and the pelvis region, there are large blood vessels. The sciatic nerve is sitting right there, and those structures have to be kind of isolated and protected. And then we use large suture anchors to reattach the tendon to the bone. We put them into a brace. They're on crutches for 6 weeks. But what's nice is actually pretty much immediately after the surgery, there's almost immediate pain relief. Then it's a matter of the function coming back. And by 6 to 8 weeks, they're walking and doing quite well. At 3 to 4 months, they return to full function. Benefits of muscle-sparing anterior hip replacement are quite significant. About 4 years ago, we introduced the technique to the Valley in Phoenix. What that allows us to do is basically put in a hip replacement through a muscle-sparing incision on the front of the hip that's about 4 inches long. What that does is it does a dramatic decrease in the risk of dislocation of the hip afterwards, which is the #1 complication after hip replacements. The other benefits are patients get up and get going faster. They typically go home the day after surgery. They take less narcotics. They have a more enjoyable hospital stay. They get up and walk the same day of the surgery, as well as there is a decreased risk of blood loss. So we've had to transfuse less patients after surgeries, which leads to less infection rates. Additionally, patients are up walking right away. They typically only need 2 weeks of home therapy. They come back to the office at 2 weeks, and at that point, we usually do not have to put them through any further physical therapy, which is nice. for the patients. And also the typical restrictions that you've probably heard about, having to have a pillow between your legs, not being able to bend forward. Those are all gone. There's no restrictions for patients after an anterior hip replacement.